So I think most patients with mesothelioma would be perfectly safe to fly on an aeroplane. The reason we need to be a little bit careful is you need to understand that the pressure in the cabin of an aircraft that is flying at 36,000 feet is not the same as the pressure of the air around us when we are at ground level. And so the air pressure is less. And you need confidence in knowing that you could cope, your lungs could cope with that lower pressure. So normally we do an oxygen saturation, a little probe on the finger that measures your oxygen levels. And if those are normal in normal life, then I think that patient would be normally perfectly safe to fly. Obviously, mesothelioma patients, different patients are at very different stages of their disease. And there are certainly some patients who I would not recommend fly because of the way their lungs are working at that moment in time. So I would say to a patient that is something that you should definitely get bespoke advice from your medical team about.